hopefully I can shed a little bit of light on my topic today. Welcome everyone, and I think it might be good morning for some people and good afternoon. So everybody, welcome here today. So first, you all might be wondering why the topic is a hidden disability. So I just say a few words about that, and then I'll go on to the topic. So I said hidden disability because one of the main reason is people with this disability are normally not obvious in the public. So a lot of people will have this disability, but it'll go unnoticed. So that's the reason I call. And also the second thing, possibly, I'm not sure how much people know about this in India. So for a big country in India, a lot of people with DCD may have gone unnoticed. That's the only reason. Then before going to the topic, I also want to say a few things. Now, I know Rima introduced me. I'd like to give a brief introduction of myself as well before start. So I graduated from Santosh College of Occupational Therapy, which is one of the first private colleges in Tamil Nadu. I'm proud to say that I'm one of the first, the batch. And then after that, I worked in a teaching institution, Meenakshi College of Occupational Therapy, for a couple of years. And then I went on to do my master's in occupational therapy, specifically in pediatrics in Mumbai University. Then I worked in a voluntary capacity in Ethiopia for 2 years. And then I finally came to my second home, Ireland, in 2007. And since then, I'm working in the health service here, mostly in a community pediatric setup. So now, so this topic, I just want to be as simple as possible to the listeners. So I have made up a presentation which could be, which is highlighted different things. But most importantly, what I want people to know is I want it to be as interactive as possible. So I'm going to stop in between for discussions and questions if you have any. Please feel free to ask any questions you have. Also, you can type in on the chat, and I'll try to answer as much as possible. So to make it more interesting, I would say that'll be the best way to go forward. Hope, is that okay? Rima, can you confirm that everybody is hearing?
Yes, sir. We can hear
Okay,
you.
perfect. Thanks very much. So I'm going to start presenting now. Bear with me for a second. Sorry, guys. Can you see the presentation, Rima?
It's not visible, sir.
Is it not? Because I'm sharing it now.
Okay, now, yeah.
Can you see it?
Yes, we can see it.
Okay, thank you. Okay, so the topic for today is developmental coordination disorder. This is kind of the medical term for it, but in layman's term, a lot of people still might call this as dyspraxia. So we'll see the important aspects of this condition today. Obviously, it's presented by me. My name is Bharat, and so I think you all heard that, so I'm not going to go over it again. So what are the contents of the session today? First, we're going to see what exactly is developmental coordination disorder. We're going to briefly touch upon the clinical features, the causes and the incidents, and the diagnostic process, and what types of interventions are available. And then finally, we'll have, and again, not finally, we'll have questions throughout the sessions anyway. So before we start, I just want people to say what you know about DCD. I know there are some professionals here who might know a lot about DCD, so I would like them to excuse themselves from this. Like anyone who's new to the profession or students, I'm going to stop here, and anybody who wants to answer this question, you can please feel free. And I'm going to pass it for a kind of a minute. I'm not going to say anything. I want to hear from you. That's okay. Anyone, please? Rima, can people answer if they want to?
Yes, yes, sir, of course.
Do you know about this? Anybody know about this? Are you in? You can type on the side as well if you want. Okay, so I think I'll continue on, and if there's any questions, you can ask in between. Okay. So DCD, in short, it's a lifelong motor skill or coordination disorder, which is characterized by poor gross motor skills, fine motor skills, partial control, and bilateral skills, which lead to difficulty coordinating movements and significantly impacting the ability to complete day-to-day functional and leisure activities. And this is the bread and butter of OT, isn't it? So it is a motor coordination disorder in short. Okay, and what happens with that is it causes problems with our gross motor skills. So gross motor skills is the bigger movements like jumping, hopping, swimming, and that kind of things. And the fine motor skills will be very fine dexterity skills, and they'll have problems with partial control to be able to sit properly and to do a stabilized movement, and also to do anything with two hands together. So what happens with this is, because of these difficulties, the children with DCD will have problems completing their day-to-day functions like dressing, sports, academic activities, and any leisure, any like as I said, sports or swimming or any martial arts, anything. So they find very difficult to do this. So how do these coordination difficulties occur in a body? So what are the reasons why that happens? So we're going to see that. So these children with DCD, what they do is, so when we do a movement, we get feedback from different things, like we get the information through our bones, our joints, the proprioception, and all that. But kids with DCD, the relay between a motor task to the brain is a little bit slow. So what happens is, instead of all that feedback, they fully rely on the vision. So they have to look everything what they do. So there is a little bit of relay problem from the movement into the brain. So that makes them a bit clumsy. So that's the first reason. And then any motor skill, which might be automatic for a lot of people or most people, will not be automatic for these children. So they need to take some extra effort or attention to complete a motor skill task. So even if they have learned it previously, it might be a task which they have done before, but still, in order to do that again, for them it is not automatic. So they have to give extra effort. So that makes the coordination difficult again. And difficulty transferring and generalizing their motor learning from one activity to another. So to simply say that, so a person might be able to climb the stairs in the house, but the same person cannot be able to climb on a kind of stair in a playground. So they cannot transfer that particular movement which they have learned in the house environment, they cannot generalize into another area. Sorry, I think there's some disturbance there. Okay. So also, they'll have difficulty to learn how to use strategies to problem solve solutions to motor tasks. So they'll try a motor task and they'll be unsuccessful. So they will. So most people, what they do, if they say, for example, if you're cycling, people do mistakes, and the next time they know it is a mistake and they'll try it differently. But children with DCD, what will happen? In spite of being unsuccessful in a particular task, they might do that again and again, the same mistake. So they will not be able to problem solve to learn that movement. So because of this, what happens? These children will be very clumsy and awkward. So whatever they do, because it's not automatic, they look very clumsy, um, and they look very discoordinated. Okay, and so what happens is they will have difficulty learning any new motor tasks. So right from the young age, so we learn tasks every day, but for these children, learning a new task will be hugely difficult, and because of that, they'll lack. I mean, they will be very frustrated with all that. So when DCD will be suspected? So it will be suspected if you see a child move very awkwardly. So their movements will not be, they can't walk properly, they cannot walk in a straight line. They'll be very uncoordinated while walking. So they might frequently trip or drop things. So while walking, they might fall over, they might hit into the door, they might bang onto the stones or anything like that. And they constantly drop things. Maybe in the kitchen when they're drinking something, they might drop the bottle. So when they pick there's something, they might drop something. So in that case, we can suspect DCD. So when they go to school age, when they start writing, the writing will be very poor, or they will take a huge effort to write, and they'll have huge difficulty completing the day-to-day activities like using, like I know a lot of people in India may not use cutleries, but still to use cutleries to pour a thing, uh, uh, the curry into the rice or anything like that, catching a ball while playing, cutting with scissors, tying shoelaces, tying buttons. There are a lot of different things which we do in the day-to-day life, and they'll have significant difficulty in that. When I say difficulty, it has to be kind of age appropriate as well. So we cannot expect a 4-year child to tie shoelaces. So you need to link and see what a child can do at a particular age, and if they cannot do or difficulty doing, then we can suspect DCD. And these children will also avoid participation in sports, physical and motor-based activities. So in school, we'll see there might be one or two people who will never be taken in the team. So they'll not be included in any games. They'll be always left out. And these people, it's only because they cannot coordinate to play the sports. And we can also suspect DCD with them. So the terminology, the most accepted terminology for this is, you can see from the topic, it is developmental coordination disorder, but still a lot of people might call it dyspraxia as well. Dyspraxia literally, the explanation for dyspraxia, as you know, difficulty in doing a planned motor act. But in medical terms, we call this diagnosis as DCD. So clumsiness can exist without DCD being diagnosed. So a lot of people can have clumsiness, but they may not have DCD, or it may not be been diagnosed. So DCD is a specific interdisciplinary diagnosis where children have significant coordination and functional difficulties, whereas dyspraxia is a commonly term used in sensory integration and mostly historically in the USA. There's one, like if people know about sensory integration, there's also a subtype of sensory processing difficulties called developmental dyspraxia. So, and it is specifically used for children with uh, motor planning difficulties. And again, it is not a diagnosis in DSM-5, which is DSM is Diagnostic Statistic Manual, which gives criteria for diagnosis of different conditions by the American Psychiatric Association. Or ICD is more a international classification of disabilities, which is based mostly in Europe. Okay. So there are a few researches has been happening about DCD historically. So the first one was in 1994, London Consensus. So they made a statement, different people from different areas, and they made.
Excuse me, sir.
Yeah.
I think your screen is not visible because someone else pressed the present now button. So, can you do it once more? And I ask everyone to please cooperate and do not press the present now button.
Okay. Where do you want to start again?
The current slide itself,
Okay.
some people are requesting that it is not visible.
Okay. Can you see it now?
Okay, 1 minute. I can see it, sir.
So hopefully everybody
Okay.
can see. Do you want to start the slide back?
No. The current slide we can proceed from where
Okay.
you. Yeah.
So researches has been happening around DCD a long time. So the first one, a lot of people around the world met in London, and they decided to have a consensus, and they released a statement. And again, in Leeds in UK in 2006, and that's where they made up criteria to make a diagnosis of DCD, and also to coin the term DCD. And then most recently, and if any professionals who have time, you can read this document. It's called European Academy of Childhood Disability. If you Google it, you'll get this document. It's a very long document which gives ins and outs of DCD, like how to diagnose them, how to make intervention. So anybody who's really interested can. So based on all this researches and all that, the most agreed term which is used all over the world now is developmental coordination disorder. Okay. So, if you go with the statistics, it affects around 6 to 10% of population, with 2% severely affected. So when I say 6 to 10 people, in a class of 30 people, there'll be at least one or two people with TCD, and a lot of times, like this is coming up to light a lot more now, but a lot of people would have been gone undiagnosed. Sorry, excuse me, and this as well. And they also say boys are 3 times more likely to have DCD compared to girls, and it can come with some other diagnosis. Like it can be, there might be comorbidity with other conditions like dyslexia, hypotonia, dysgraphia, dyscalculia, and ADHD. Dyslexia is more kind of reading difficulty. Hypotonia is low tone. Dysgraphia is difficulty with written expression. Dyscalculia is difficulty with maths or calculations. ADHD, probably you all know, attention deficit hyperactive disorder. So, and it also come with like autism as well. So DCD does not impact a child's intelligence, although it can cause learning problems in children. So, so the IQ should be normal anyway, but they can cause learning problems just because they cannot cope up with the other tasks. They cannot organize themselves in writing or taking a book. So that can impact the learning in a secondary way. Okay. Again, it's a lifelong condition one is born with. Okay. What causes DCD? There's no clear answer for DCD. There's still research going on to see what is causing it. It's very unlikely that it's a single factor will explain. So there might be a multitude of factors, but kids with DCD they're born with it. It's not something which comes later in the life. They're born with it. And most recently, the latest research what is say they suggested a possible. I mean, again, it's still not 100% sure. A possible link between cerebellum and the challenges seen with DCD, because cerebellum is the part in the brain which controls the coordination in general. So they're saying there could be a little bit link there, but still, it's not 100% proven. We're going to the diagnostic criteria. This is more kind of a medical, so I haven't changed anything in this slide. This is exactly which is laid out in DSM-5. As I said, DSM-5 is Diagnostic Statistic Manual 5. That is the latest classification of psychiatric disorders, which is done by the American Psychiatric Association. So it classifies DCD as a discrete motor disorder under the broader heading of neurodevelopmental disorders. In DSM-4 and the earlier versions, it's been called as a learning disorder, but now it comes under neurodevelopmental disorder. So the specific criteria would be acquisition and execution of coordinated motor skills are below what would be expected at a given chronological age on opportunity for skill learning and use. Difficulties are manifested as clumsiness, example, dropping or bumping into objects, and as slowness and inaccuracy of performance and motor skills. Example, catching an object, using scissors, handwriting, riding a bike, or participating in sports. So this is the first criteria. What it says is acquiring and execution motor skills will be delayed, and that will be below what is expected normally at a given age. So even though they get a lot of opportunities to develop that skill, and that will be still be below the expected level, and it can be manifested in different forms. They might be clumsy, they'll be slow to do things like self-care tasks, catching an object, using a scissors, or participating in sports. So in order to be diagnosed with uh, DCD, everybody has to qualify for this criteria first. And the second one, the motor skill deficit significantly or persistently interferes with activities of daily living appropriate to the chronological age. So this difficulty, the criteria, the first criteria should significantly impact everybody's ability to do their self-care task. So self-care is slightly different of different age. For a 5-year-old, eating independently or dressing independently. For a 10-year-old, it might be tying shoelaces or school productivity. Or for an older person, it could be a pre-vocational or vocational activities. And again, leisure and play. So sports or music. So they'll have difficulty in all that. This motor coordination will affect that. And the third one is the onset of symptom is in the early developmental period. As I said, people are born with it, so it has to be symptom has to be there in the early developmental period. And final criteria, this is also very important. The motor skill deficits cannot be better explained by intellectual disability or visual impairment and are not attributable to a neurological condition affecting movement. So they should not have any neurological condition like cerebral palsy or any muscular condition or a degenerative disorder. Their cognitive ability should be average, so that means they shouldn't be the motor skill should not be deficit should not be explained by any cognitive disability or any other like visual or hearing or any difficulty. So if they qualify for all this, and they can be diagnosed with DCD. Okay, so I'm going to stop here for a few minutes. I would like to welcome some questions if you have anything, because I don't want to be boring with my continuous presentation here.
Sir, I'm sorry to
Yes.
interrupt. Some people are still finding it difficult to view the slides. So, but it is visible for some people.
Okay.
So, can you close it and try to present it once more?
Okay. Okay. Will there be a
Uh,
problem with their side? I'm not sure. Is there a problem with their side as well?
uh, I'm not sure, sir, but
Okay,
you
I'll try
could.
again. I'll do it again. Okay.
Yeah, okay,
In
sir.
the meantime, people can ask questions as well, and I'll stop sharing and then I'll presenting it again. So, uh, I mean, it's open to questions now. So I'll give 5 minutes here.
Okay. Thank you, sir.
Can you see it now?
Yes, sir. I can see it. Can all the participants respond in the chat section if it is visible. Can few of you please respond, whoever was finding it difficult?
Also, in the
Okay.
meantime, I would
Yes.
invite people for any questions until now. If you want me to explain anything,
So there
please.
was a there was a question if whether DCD and dyspraxia are the same. So,
Okay. Like they're not exactly the same. Like what happened was, in terms of terminology, dyspraxia, DCD was originally called as dyspraxia in the past, but now there's a separate term. Whereas dyspraxia is more used in a subclassification of sense integration. I mean, people can have dyspraxia without DCD. Dyspraxia would be just a difficulty in doing a movement. So it's a planned motor act, and it can come with other conditions like SPD and all that as well. Whereas DCD is more has to follow all this diagnostic criteria. So it's just it's an umbrella term if you call it. Dyspraxia will come under DCD rather than they're the same.
okay, thank you, sir.
Also, even professionals can ask questions. If you're experienced with seeing children with DCD, you can still ask any questions, and I'll try to.
So, Dr. Kannan has asked, do you need a pediatrician referral or teacher or parent can refer to OT?
Okay. I don't know about other countries. Like different countries will have different system. In Ireland, in the service I'm working, it's an open referral, so anybody can refer. Teachers, parents, or any professionals. Anybody can refer for a diagnosis of DCD.
Thank you, sir. At what age DCD could be diagnosed?
Okay, I'll answer the question in a minute because it's sorry. When I go to the diagnostic process, I'll answer that question. Okay, I'll keep it that mind. So, because
Okay,
I'm still not there. I still haven't gone to diagnosis, so I will answer all that question.
okay.
I think I could still see some people's video as well on this.
Yes, sir. So there is one question. You had mentioned that it's a lifelong disability. In your experience, have you seen them coming out of their diagnosis? Can they live a normal, productive life?
That's a very good question. I have answers for that in my next few slides, but because you asked, I'll answer that. It is a lifelong condition, but if you intervene quite early, if you do an early intervention, there won't be any difference in their quality of life. They can perfectly live a normal life. So what happens is, if this has not been diagnosed and people will left with secondary difficulties like emotional or behavioral difficulties, it can affect the quality of life. But if they had their own accommodations for the condition, they can live. So most people with DCD can learn any task, but what happens is any new task will be still difficult for them. And that's why we call it a lifelong condition. And what happens when people get older? They use the cognitive strategies, and they will be able to compensate for that difficulties. And so, I'll refer back to the word I said, hidden disability, and that's why it's called hidden disability. A lot of people, as they go older, what they do is they hide this disability by using cognitive strategies, and they can compensate with other things as well as they get older.
Thank you, sir. There is one more. Is there problem in bilateral integration?
Yes, they will be, because the two sides of the brain have to work together, and because the coordination is still there, so they cannot coordinate the both hands. So maybe when the first hand gives, the brain gives a command to the first hand, okay, pick the fork in your hand, and the brain gives a command to the second hand. There's a delay in both the process, so they don't go together all the time. So there will be obviously a lot of delay in bilateral skills as well.
Is it hereditary?
Still, there's not much evidence. Yes, but it can be. I mean, there's no clear evidence on that, but again, it can be hereditary.
Okay. Then another question is how ataxic CP is different from DCD.
Okay, so that's a good question. If you look at the criteria, the last one, people cannot have a motor condition. So whereas cerebral palsy is a purely a neurological condition. So if somebody has a brain lesion or brain damage, they cannot be diagnosed with DCD. So it is very minimal. So I know I said cerebellum can be involved, but it's not like as in cerebral palsy where there's a complete brain injury. So if somebody has cerebral palsy, it is more a neurological disorder where obviously the disability will be clearly visible. But in here, you see the people moving normally, and you can see the coordination only if they do a particular motor task. So there will be. It is not a neurological uh, condition as such.
Okay, sir, there is one more question. Can you kindly explain about the prognosis of DCD? So, will you
Okay,
be explaining it later or now?
I can explain it later. I'll quickly touch upon it. It's the same answer for whether we can grow out of this. So DCD cannot be cured, but with a lot of strategies, we can make people do a normal life, or they can do a lot of, I mean, everything in a normal way. But it has to be certain strategies has to be put in place. But DCD, the condition itself cannot be cured. Okay. So what I'll do is I'll start. Go to the presentation again.
Okay, sure, sir.
I'm just have a slideshow. I'm going back from the start. So who can diagnose? So it's diagnosed by a multidisciplinary team. At the top, I have put occupation therapist because DCD is one of the diagnoses where occupational therapists will be at the forefront of diagnosing. So all over the world, mostly it's occupation therapists who initiate the diagnosis of DCD. Um, so what they do is they assess the motor skills and the functional implications because self-care skills and the functional aspect. So it's bread and butter of occupation therapy. It's what we do. Our life, our whole occupation therapy itself is about functional impact. So that's why we have occupation therapy right at the top. So then we have a medical doctor, usually a pediatrician, and so why they have to be there? Because if you look at the four criteria, the first and two can be can be checked by an occupation therapist, whereas the last one to see if they have any medical or muscular or neurological disorders, it can be only done by a medical doctor. So they have to be there as a team as well. Psychologist, so to see if they have a learning disability. When I say learning disability, we talk about intellectual disability. So if a person has intellectual disability, they cannot be diagnosed with DCD because their difficulties can be attributed to the intellectual disability. So we need a psychologist in the team as well. Then we have physiotherapists. I mean, physiotherapists can be there to assess the motor skills, but like even without a physiotherapist, we can still diagnose DCD. But mostly a doctor, a psychologist, and an OT. Sorry, I have some disturbance, I think. So, so any of these team members, if they have the other information, say if a person goes to the doctor with an OT occupation therapy report saying this child has poor motor skills, the medical doctor can confirm the diagnosis. And if the referral comes from a doctor to an OT, which says there is no neurological disorders, then the OT can diagnose. But usually it is a team diagnosis, so they should have all this information before we make the final diagnosis. Um, so the diagnosis of DCD should be made within a diagnostic setting by a professional who is qualified to examine the specific criteria, like uh, the criteria we had of the DSM-5. Then in a lot of cases, we'll have coexisting conditions like DCD, ASD, ADHD. So we need to be assessing for that as well, if it is in a team setup. So as we read the diagnostic criteria, so I'm going to see how we are going to individually see those diagnostic criteria. For the first criteria, where we said about acquisition and development of this motor skills, so to see if somebody has difficulty with that, usually a standardized motor skill assessment should be used, a norm reference motor test. So I have a couple of examples that this is mostly used all over the world. One is called Movement ABC2, which assess the motor skills of different children of different ages. And then we have the Brunisk-Osersky test of motor proficiency. So these two are highly recommended, but any kind of standardized motor skill assessment can be used. But if there is a setup where you cannot use a standardized motor skill assessment, you need to have a rough idea what a child can do at a certain age, and you can compare that, and you can still, as a professional judgment, you can still make the diagnosis. But the best practice guidelines say you have to use one of these standardized tests. So if they have to score below the fifth percentile, what is the fifth percentile means? They have to be poorer than 5 people out of 100. So if they get that score, then we can think about they'll cross the first stage of the DCD diagnosis. And clinical judgment can be used to determine the specific domains of dysfunction. So that's what I kind of said. If you don't have the available instruments, you can use clinical judgment as well. The second one, you can use a lot of valid questionnaire recommended like information from schools, parents about the way they write, about the way they do their self-care skills, about the way they do the sports and all that. So that is the secondary impact of the primary motor skill difficulty. So you can have a lot of questionnaires. You can complete interview. If you don't have questionnaires, you can still ask the parents, okay, what is he have difficulty with? Can he dress himself? Can he put on his buttons? Can he zip up his coat? Can he put on his shoes? Can he write properly? Can he hold the pencil properly? You can ask a lot of questions like that, and you can get all those information. So there is also some questionnaires called DCDQ, Developmental Coordination Disorder Questionnaire, the Movement ABC questionnaire. Whereas in the first one we saw more about an assessment which can be done only by professionals, whereas this questionnaires can be completed by parents or teachers. Then we need to consider ADLs, occupational areas like leisure, play, home, and school. And again, views of the child, the parents, and any people relevant. When you say relevant to others, the school, teachers, a coach of a martial art, a swimming coach, and things like that. So therefore, very careful history taking is very important in order to make this diagnosis. Criteria 3 and 4, where we saw about cognitive ability and medical status. So appropriate examination need to be include neuromotor status, the medical status, the kind of sensory status. When I say sensory here, it's more about visual and hearing, kind of the special senses. Then emotional and behavioral status and cognitive function. So if you have all this information, and then we can make the diagnosis. Okay. So what are the areas of dysfunction these children might have? Poor motor planning. So to do any motor act, we need to plan, and a lot of this planning will be automatic. So if you want to brush your teeth in the morning, you don't think how to brush your teeth, but kids with DCD have to think before how to brush, and that make them look very clumsy. So that planning aspect will be one of the difficulty they'll have. They'll have difficulty with gross motor skills. Gross motor skills is the heavy movements like hopping, jumping, catching a ball, running, swimming. So they'll have difficulty with that, and they'll have low muscle tone. They'll have difficulty with fine motor skills like dexterity skills, picking up small things, putting on a button, opening a key, opening a lock. Then they also have sensory integration difficulties. You all probably know about sensory. I'm not going to go detail in that now. They'll have poor body awareness. So they may not know where their body is in relation to the environment. So they don't know what their hand is doing. So they have to look before they do everything, and they'll make them clumsy. Visual perceptual skills or visual motor difficulties. So visual perception is they cannot perceive what they see. So things might look bigger. They cannot differentiate between figure ground. So things might look closer to them than it is. So all this difficult, our movement with eye, that again, it's visual motor difficulties. They all they may have all of this, and they may have some of this. So it's not always they have all of them all the time. Okay. So how does it impact the dysfunction on the daily life? The children with DCD will have difficulty with self-care. So again, it's age appropriate. A 4-year-old or 5-year-old will have difficulty cleaning themselves after toileting, to put on their clothes, put on the shirt. They'll have significant difficulty playing with physical education and sports. They cannot catch a ball. They'll have difficulty with handwriting. So they cannot hold the pencil properly. They cannot form the letters properly. They will have difficulty keeping up on the line. Poor organization. So when they sit for studying, they cannot keep everything together for themselves. So they have to go and look for everything. They will forget things. So they cannot organize anything in what they do. And they'll have difficulty following instructions. So if you give an instruction to them, they'll have difficulty following that, because by the time the brain processes what the instruction is, the body will not react to what they have to be doing. So because of this primary difficulties, they also will have difficulties with their concentration and social difficulties. Say if somebody is not able to play sports, obviously that's one of the main way kids socialize. So that aspect will be also affected. And then finally, they'll have a lot of behavioral and emotional difficulties. And that's basically because they'll have a lot of frustration because they cannot do things which their friends can do. So constantly, they'll be frustrated because they cannot do, and that will lead to behavioral difficulties. They can get aggressive. They can completely shut down. They'll be emotionally detached from other people, or they can be have anger issues. So these are kind of secondary difficulties which can be impacted by DCD. Rima, can I confirm that everybody can still see me? Do you have any other complaints?
No, sir, we haven't received any complaints.
Okay, no problem. So I'll go on.
Okay, thank you.
So I have a little graph there. I hope you can see it clearly. So what this graph, it's exactly the same which I've explained now, but it's based on the age. So if you see the first one, so between the age 3 and kind of 7, this is what will be more prominent. We'll see delay in fine motor and gross motor skills, late riding a tricycle, cannot go on a scooter. When I say scooter, a little scooter which you scoot with a leg. They cannot catch a ball or throw a ball with accuracy, cannot ride a bicycle, difficulty jumping. So this all we'll see between age 3 and 6. Then self-care. So usually we'll see between age 4 and above, difficulty using cutleries or utensils, need help with dressing and grooming, cannot tie shoes or do zippers and buttons, messy eater, cannot cut meat. So cannot cut meat and all that may not be an issue in India because we probably don't use the cutleries. This most seen in Western countries possibly. And then around school going age, like I know in India kids go to school at 4 or 5, we have it at around 5 6. So they'll have awkward pencil grasp, difficulty completing a written work. There might be a huge gap. This child might be very intelligent, they might be able to say everything verbally, but they'll have difficulty putting that in paper. And then if you go a little bit, so all the social skills until kind of 6 and 7 we may not see it really, but when they go from 7 8 9 age, we'll see they'll have limited participation in sports and extracurricular activities. They tend to watch instead of participating. They can be victimized, bullying, so people can call out names in school, and even friends or relatives they can call that as well. And there'll be social isolation. And but we can have behavioral and emotional problems throughout from young age, because they cannot do anything which others of their age, and they'll avoid a lot of things like playing with fine motor skill activities. Like they'll avoid cutting, they'll avoid using a pencil, they'll not go to sports, they can get frustrated, and they can be they're low self confidence and low self esteem, and they think they don't know, they're not good at anything. So these children will go anxious, depressed, or withdrawn. So if we see them quite early, and if you intervene at an early age, all these behavioral and emotional difficulties could be easily avoided. Okay. So this is just kind of an example. So it says grade 1. So think of a child. If you have children, or you can see in India what they right. Like this is a typical grade 1 in kind of a Western, say first class in India. So this is how possibly a typical writing would be. I mean, it could be better than this, but this is the typical writing. But same class people, a child who was DCD, this is how the writing would be. It's exactly the same kind of thing, but like you cannot read anything because they don't have any spatial awareness. They have poor control to write. So see, you can see the difference. So it's very clear here. You can read what it says, but you cannot. So that's kind of the it's the same age children, one with DCD and one is a normal child. Okay. So I'm going to stop again briefly here, just to take any questions. So in the first question hour, we talked about general features of DCD. The second one, we talked about a little bit on diagnosis and what kind of clinical features they would have. So I would welcome some questions. You can type the questions to Rima, or you can ask. I hope they can hear me, Rima. Hello?
Yes, so we can hear you.
Oh, yeah. Any questions? Any discussions? Anything?
So there are a lot of questions in the chat box. Should I read it to you?
Okay, I'll have a look. Sorry, because I'm presenting in the slide mode. Okay. 1 second. I'll go back there.
I have a small request. Some people's videos are still on, so please switch off your videos.
Okay, I have a few questions. I'll go from the bottom. See, I probably missed some of the chats. So, how do you differentiate between handwriting of a child with learning disability and DCD? Okay, now, so it's very hard to differentiate. Like when I say children with learning disability, more in the likes of dyslexia, they'll have their own difficulties, and that will be caused. It's a more learning disability. So these children will have a problem forming the letters, which comes from the brain. Whereas with the DCD, the forming of the letters, the difficulties will come from the motor skill difficulties rather than which is because of a learning disability. And kids with learning disability will have problems with spellings, forming the letters. Whereas with DCD, it will be more the control, how they control the handwriting. But when we are assessing the handwriting, we need to look at the both aspects as well. Okay. Somebody else asked, is there any correlation between executive function and DCD? Yes, there's a huge correlation between executive dysfunction and DCD, which is one of the biggest research areas at the minute. A lot of children with, when I say executive functions, it's about organizing yourself, and this usually comes when an older age. So they cannot, because they're so disorganized, they will miss out on a lot of executive functionings. So somebody else asked, does this fall under learning disability? No. So learning disability is mostly diagnosed by educational psychologists, whereas DCD is more kind of a motor learning disabilities. But kids with DCD can also have learning disabilities. Somebody has asked, what are the tools we can diagnose DCD? And I think I have explained that. So we can use any standardized motor skill. The most commonly used will be movement ABC and Brunitz, but you can also use kind of non-standardized as well if it's limited availability. Is there any evidence for age-related dysfunction in DCD? I don't know if there is evidence, but like the difficulties with dysfunction in DCD will change with age, because as we grow older, the demands which is placed on you increases. So that so there will be there. Diagnosis before 3 years could be a challenge, I think. Yeah. Now, we don't diagnose children. The best practice, they say, don't diagnose anybody with DCD under 5. But in experience, we don't diagnose anybody under 6. I'll say that's because until 6 or 7, we don't know how it is impacting their day-to-day functions. And kids with DCD will they will still have those difficulties in spite of intervention. Whereas a child with 3 years might present with some motor skill difficulties, but with some intervention they'll improve. So that means they don't have DCD. It could be more just environmental. They didn't give an opportunity to do any of those. So once given an opportunity to work on those skills, and if they make an improvement, then it cannot be DCD. Somebody asked, is there any scale which can identify this problem early in ICU? I don't think so. We cannot identify DCD at that young age, but a lot of children with DCD will be they can have low birth weight. There is a correlation, but we cannot say until they are 5, 6 if they have. Some ASD children have these problems. It can be considered as DCD. Now, you need to make sure those problems are not related to ASD. But if they have these problems and also ASD, they can be dual diagnosis as well. I think so. I don't know if I have missed any other questions. Uh, if I missed anything, you can feel free to ask as well. Any more questions? Can you see the slides, guys, now?
It's a screening tool for early intervention.
Screening. So we can use, there are a few screening tools. One is called Ages and Stages Questionnaire, which actually gives up to 36, no, it goes up to 48 months, I think. So it's not exactly a screening tool for DCD, but it's more to see if they have any motor skill difficulties. And also the movement ABC have their own questionnaire, which gives an information on it. But like we will never diagnose someone under 5, definitely. So so we normally don't use a lot of screening tools at that age, but it is just to see if their motor development is in the normal, in line with the normal developmental scale. So we use those scales. Okay. Any more?
There is one more question. Does a child with DCD shows involuntary movements also?
So involuntary movements, they can have some associated movements, but involuntary as such would be more a specific neurological disorder. So most likely, no, they cannot have involuntary movements. I think I'm not seeing the chats now because if I go there, I can share this. So, Reema, if you could read out any more questions on it. I mean, sorry about that.
I think that's all, sir.
Okay.
You have mostly answered
Okay.
everything.
Okay. So, so we have one more kind of thing to go. So before that, I'm going to show you a couple of videos. So just to see, to put them into your in the shoe there. Bear with me for a second, okay? I'm going to present this screen now instead of the other one.
This video compares the task of buttoning up a shirt for a typically developing 8-year-old child and a 13-year-old with developmental coordination disorder. Note the difference in the length of time that it takes the 13-year-old to complete the task and the level of concentration and effort that is required.
while simultaneously isolating hand and arm movements. Secondly, he learns each ball task that is demonstrated quite quickly. Typically developing children demonstrate effective learning of new motor tasks. He also shows consistent and automatic motor performance. Once he has been shown the task, he learns it quickly and performs it with very little effort.
So what we saw there was a child with normal developmental playing a ball. Now I'm going to show you another video where a child with sorry guys. Now.
Child has developmental coordination disorder, or DCD. Although he appears small, he is just 9 months younger than the first subject. He has difficulty keeping his body or trunk muscles stable and isolating movement in his upper body. This child does not learn by observing the task or even by doing the task. His approach is random and disorganized. Each attempt at the ball skill is different. There is little consistency in his performance. For example, he uses variable force in bouncing the ball. Finally, as you may have already noted, this child has extra facial movements. This may reflect the amount of effort required to learn and perform this simple motor task. It is no surprise that this youngster covers up his difficulties by being a little silly.
Yeah. So you've seen that I showed you I think 3 videos. In the first video you saw a boy who was wearing his shirt, a normal child, and also a child with DCD. You can see the difference, the difficulties the child with DCD had while buttoning his shirt. The second one, again, is the same. Nearly same age boys. You can see the difference how they were catching a ball. So that's what the difficulties they have. Okay. Now I'll go back to the presentation. So the last final would be on the intervention. So what kind of treatment availability is there? So usually a child with DCD, they need to be seen by a multidisciplinary approach. So the first and foremost, it's a child and the parent. So a lot of child might have this difficulty, but is there a problem? Is it causing a functional difficulty at home or in school? And if it is not, this may not need any intervention. So firstly, we need to see what are the views, the child and the parent. Then I always put occupational therapists at the top of for intervention with children with DCD. And then we can have physiotherapists to work on the gross motor skills, partial control, and all that. When we need an educational and clinical psychologist. So children with DCD will also have speech and language difficulties. So a speech and language therapist. An orthoptist would be more to look at the visual difficulties they might have. A pediatrician to check for our own any other any other medical difficulties. A dietitian and orthotist. So it's not always we need all this team. So the most important people would be the child, the OT, a psychologist, they will be the kind of the most important people, but we also need other people as well if we need to give a holistic intervention. So best practice guidelines, the intervention that are evidence-based and grounded in theories that are applicable. So we need to always use some kind of an evidence-based. Intervention should be functional and based on activities that are relevant to daily living and meaningful to the child, parents, teachers, and others. So this is the most important thing I always say to professionals, parents. So there might be a lot of intervention possible. We can bring a child to a clinic and ask them to throw a ball 10 times, or he catches 10 times today, he's catching 12 times tomorrow, so it is improved. But that is not should be a focus on. As an OT, we always deal with functional aspects. So our main goal is, it's not about how many times he's going to catch. Our main goal should be, can he go into a social situation or a kind of a situation where play sports? Can he go and enjoy that game? And that's what should be our aim, rather than getting him to do 50 times or 100 times. So that's not going to do any good for him. Okay, so we should have a collaborative goal setting with the child. So we need, if the child is old enough, we can get the goal setting with the child. Otherwise, we can also have the goal setting with the parents and carers. So involvement of number of individuals who can contribute, like parents, teachers, coaches, health professionals, other people. So we need to have a goal based on information or input from all these people, and also accommodate the contextual life of the family. So most importantly, what kind of situation is at home? So based on that, we need to make goals. So rather than making a goal as improve the child's fine motor skills, improve the child's gross motor skills, you have to say, okay, can the child go in a bike from school to school? Can the child go to swimming classes? So we, whatever the important needs of the family, so we need to make goals according to that. There are different approaches used. So some approaches are bottom up, some are top down. So bottom up is more, we're developing the skills first. Like we can use sense integration approach, a motor training approach, process oriented approach, a motor skill training. So these all kind of bottom up. So we develop the skills first, whereas top down, task specific intervention. A child might come to you, child might have poor motor skills. They cannot do a certain task, so the handwriting will be poor. So that is a specific task. So we work specifically on the handwriting. They cannot tie a shoelace. So we specifically work on that. So there'll be more specific to that. So there are some standardized measures as well, which a lot of OTs use around the world. They call COPM, Canadian Occupational Performance Measure. This is more, it's more the child will bring their own goals. So it's a kind of questionnaire. So we ask them what is important and they can do that. And then we can use a cognitive approach called goal, plan, do, check. So how does this work is, we bring the child and ask them what is the main goal. So then we plan, okay, what are things we need to do to make the goal work? And then go and do the plan and then check, okay, has the goal been achieved? So if the goal is not achieved, you go back to the plan stage again and work back. So these are some of the approaches used to treat children with DCD. How OT can help. So we can help in a lot of ways. So we can improve the motor skills by using a bottom-up approach and functional independence. Though, like this is one of the main thing we do always. Functional independence is bread and butter of occupational therapists. So we have to individually see what makes them to do difficult their self-care skills. So we work on that and we provide strategies to improve their self-care skills. We can consult with schools in relation to difficulties sitting still in school, doing a handwriting, following up the school, organizing their materials in school. Then assist with developing handwriting skills, assist with development of organization skills, how to organize the materials in school. And then for older children, use of assistive technology. When they have difficulties with handwriting, assist technology can be, there's lots of assistive technology available now, using a laptop, using voice systems to write instead of writing, and recommend accommodations in state exams. I'm not sure how much is relevant in India, this state exams. They can, instead of writing, they should be allowed to use a laptop or a voice recorder, so that, because these people, they'll have good IQ, they'll be able to say everything verbally, but when they put in the paper, they cannot do, so they can fail in the exams. So this accommodations, and usually these are recommended by OTs, based on OT's report, it goes there. Okay. So we have a concept called MATCH. So it's a kind of an acronym, we can use it to learn. When a child with DCD is learning a new task or having difficulties with activities, match is a helpful framework. So it can help to guide. As an OT, it's a very important thing which can guide. The first thing, M stands for modify the task. So if a child have difficulty, I'll give an example how to modify tasks. So if they're playing a ball, so if you throw a tennis ball, the child finds very difficult to catch. That's because the ball is too small and he cannot coordinate. So we can modify the task initially to slightly increase the size of the ball. So it'll be easier for him to catch. So that's one thing you can do. And we can do across different aspects. And then alter your expectations. So if you expect your child to do a certain task, if they cannot do, and if you're going to how to say give out to him, or you say, oh, you cannot do that, or if you reprimand him, then it's going to affect his confidence. So you slightly change your expectations. So with children with DCD, if you lower your expectations, he may not be able to do that, but instead he can do something else that will give confidence to him, and also you'll be also happy. Then street strategies. So to then if this didn't work, you can also change the strategies. So for example, normally a lot of people teach shoelaces in a certain way, but you have to simplify the strategy and use different methods, which will be easy for him to understand, and then they'll learn that. Then change the environment. So sometimes they can be, so if you want to teach them ball skills, if you go to a soccer area, it will be very difficult. The whole environment will be very intimidating for them. So you can teach soccer skills at the back side, or someone, just yourself and your child, and that'll be more easy for him to learn. And without any fear of failure, he will learn it easily. And then finally, this is more important. Everybody who's involved with the child with DCD should understand the difficulties. So if you understand the difficulties, most of the problems are solved, and you can help them. And once they know they can get help from you, it's easy. And once you help them to work with their difficulties, it'll be also useful for them. And then it'll avoid all those secondary difficulties of emotional and behavioral difficulties. So some general tips. These are some general tips to work with children with DCD. Consistency. You have to teach the same thing again and again consistently, and they have to follow the same pattern. It will help them. So same, the next one is kind of the same repetition as well. Always give clear, short instructions. If you give a multiple instruction, they'll find it really hard. If you teach something and if you say 3-4 instructions together, they will miss all of them. So go step by step and work with their own pace. So you need to understand what is the learning level. Not their learning is good. What a pace they can do a task. So you need to go with it and help with them. Always praise their efforts. So one of the main difficulty we see with children with DCD will be poor confidence. So if you constantly praise for efforts rather than wait to praise them if they've done something. So instead of that, if you praise throughout their efforts, that'll help them to achieve the task much quicker. Always try to balance assistance with independence. So it's always don't give constant assistance for the child. So you have to give some assistance, but you also get them to do independently, which also improve their motivation and confidence. So I know a lot of people have asked these questions. Do children with DCD outgrow their motor difficulties? No, they don't outgrow their motor difficulties. Well, it was once thought that children with DCD was simply outgrow the difficulties. Research tells that DCD persists throughout adolescence into adulthood. Children with DCD can and do learn to perform certain motor tasks well. However, they have difficulty when faced with a new, age-appropriate ones and are at risk of secondary difficulties that result from their motor challenges. Although there is currently no cure for DCD, early intervention and treatment may help to reduce emotional, physical, social consequences that are often will be as a secondary disorder. So as I said earlier, they don't outgrow the difficulties, but with early intervention, a lot of things be avoided. And like once they go into adulthood, nobody will know they have DCD. You might have seen a lot of children or adults with DCD around you, but you would have never noticed. That's again why I called it at the start, it's a hidden disability. So if they've been given the proper intervention or proper early intervention or proper support or proper understanding, they will never have any secondary difficulties. And they can learn their own strategies to be highly successful in their life. A lot of people with DCD are quite highly successful as well. So this is kind of the end of the presentation. So I'm going to ask you if you have any more questions. So this is the, so I've kind of finished all my actual presentation, but
so there are questions in the chat box. Should I read it to you,
yeah,
or
I'll look at that now. I'll look at that. Sorry, I'll go.
Okay, thank you.
Okay. Somebody says, how do an orthotist contribute in the treatment of DCD? Okay, orthotist. So it's not a direct relation to DCD, but like kids with DCD, they'll have low tone in general. So what it lead to, because they have poor motor skills, they'll have problems with the arches in the leg, and they also can cause coordination difficulties. They also can contribute to the diagnosis as well, because we get a lot of children with they say, oh, the child is very clumsy, he falls over. But all they had was little problems with the foot arches. So when an orthotist give kind of arch support for the legs, and then they never had the coordination. So they can contribute both for the diagnosis, but also for treatment. So how speech and language therapy will be helpful for a child with DCD? Again, children with DCD can also have speech and language therapy difficulties, because there is something called verbal DCD. Well, they don't call verbal DCD; they call verbal dyspraxia. So because there are also muscles in to speak, so they find it hard to find the words. So a lot of children with DCD will have linked speech and language difficulties. So speech and language can help that as well. Does it have any correlation with child having low muscle tone? Yes. So a lot of people. So when you say low muscle tone, not exactly like hypotonic CP, but generalized low muscle tone, which is not in the likes of a neurological disorder. Yes, a lot of people with DCD will have low muscle tone. Children have oromotor dysfunction. Yes, because there are also muscles in the mouth. A lot of children with DCD can also have oromotor dysfunctions. When a child is having difficulty in jumping still at the age of 6 and writing speed is really slow, but verbally can answer the question better. Yes, yes, if the child has difficulty jumping and her writing speed is slow, not just because of that, the child can be diagnosed with DCD. You need to, yes, the child may very well have DCD, but you have to follow the guidelines of the DSM to make a full diagnosis. I think I have answered most of the questions there. Subtypes, somebody asked for subtypes. Sorry, like we don't diagnose any kind of subtypes. These subtypes will be more, if you look at if you go on a course on a sensory integration, they'll have subtypes of DCD, like they call motor DCD. Like generally, we don't have any subtypes of DCD. There is a question, correlation between SPD modulation, discrimination, DCD's motor performance. Yes. See, I didn't go too much into sensory integration, but a lot of children with DCD will have underlying sensory processing difficulties, because sensory processing will also involves proprioception and vestibular. So there is a strong correlation. But like as what I have given today is just a drop in the ocean. There's lots more. So there is a strong correlation as well. They have milestone delay and speech delay. Yes. One of the first thing, milestone delay is one of the first indicator of DCD. The children with DCD, they will be slow to achieve the milestones like crawling, walking. So the milestone will develop, and that's the first indication to see whether they have. Okay. Okay. Any more questions?
Sir, I would like to ask something. So,
yes, sure.
I don't know if this is relevant, but I have heard that abroad, outside India, a lot of cases of DCDs are being treated. And do you think in India we don't recognize it as much as abroad? Or
It is a very good question. See, I want I was really looking for this question.
Oh,
You see,
thank you, sir.
I myself is a little bit out of touch with the current situation in India about DCD. I myself is not sure how many of people, and I don't want to say you don't know. A lot of people might know, and they're working on DCD. So I really don't know. So I need to know from people if they treat children with DCD in your clinics or anything, which can be helpful. Uh, it is well known outside India. In the Western world, DCD is very prominently known. I myself is not 100% sure how much people know about that in India, but it's very well prevalent. Like when I grew up in India as well, I would have seen in my classroom there might be people who may not be picked for teams, who would be very clumsy, but we never. So what happens with these children? People call them names, or the parents just, oh, he's just lazy, he will grow out of it. So that's what the attitude we get. So a lot of things, uh, which is a compliment to people in India, is the parents are a big therapist in a lot of these cases, and they teach them and they understand them as well, and they teach them a lot. So a lot of these people never come to clinics, but I definitely feel there's a lot of these things relevant. I mean, prevalent in India, but I'm not sure how much is being picked out. So I would guess some input from yourself to know, like not you. I mean, people from working in Indian clinics, some professionals. I'll be really interested to know.
So I think even to be honest, I wasn't very. I have heard about it, but I wasn't very detailed.
Okay.
I didn't check it so very detailed. So I think we often confuse the writing disability with the learning disability. So I think from now on, I'll give more importance to DCD.
Very good. Like I hope even this helps people to little understand the DCD, and if you could people coming to you, you can look at a different angle with the children. It'll be great. My email is there at the start of the presentation, and anybody can call me or anybody can ask for more. If you want to know more about the profession, especially professionals, if you want to know anything more, please do contact us. We are ready to help anything. So I think I have a few more questions there. I'll go back. See, have the children gone to college and led a normal life? Yes, they will definitely. There will be no issues going into college. See, there are some people who may not have been seen when they're young. They get into behavioral emotional difficulties, and that will impact. But otherwise, technically, they have no problem in going to college or anything. I think I've answered this question. Somebody asked about differentiate handwriting of LD with DCD. So difficulty handwriting with LD is more related to learning, whereas with DCD it will be more related to fine motor skills or handwriting, how they control their writing. That will be the major difference. Any more questions, guys? I hope I did justice to my presentation. I know it's I have to balance. I know there's a lot of students and also professionals. I was trying to balance as much as possible to keep it simple and informative as possible. But if you need to know anything more, please do contact me. I don't know if everybody noted my email at the top. I can type my email there and my number. Anybody can contact through WhatsApp or email. Any questions? I'll answer the questions as I'm going.
Is there any case example that you had experienced in your practice years?
Yeah. So the surveys I'm working mostly DCD. So we'll have a lot of children will come with handwriting difficulties on its own, motor skills. They may not be diagnosed with DCD, but there are a lot of children who comes with DCD. So there are some. I can't think of exact. Some the difficulties will be very mild, and they can like I had a child who came to me only at kind of 12 years, which was it was never noticeable when he went to secondary school. They found he was struggling hugely, not because of problems with learning, but because of motorcycle difficulty. He had secondary difficulties. So he was refusing to go to school. So once he came, we identified his difficulties. So he was diagnosed with DCD. Once he knew the diagnosis, and parents and school and ourselves, we had a meeting and we knew what to expect of him. So once he know his own difficulties and the parents know and the school know, things were put in place to provide accommodation. So that changed immediately. Within the next month or two, he was a completely different person. Because instead of writing, he was given a laptop to type. So he was never forced to go for sports or anything. And then he went very successful with college after that. He got high grades, and he went to college. He got engineering, and so it's that's what will happen. So if you don't see that quite early, they'll have all those difficulties still hidden, and that will impact their day-to-day life. But once you know, once we understand what they have, it's very easy. I'm not saying easy, but if you have the right strategies in place, they can lead a very normal life, just like others. And there are also lots of successful persons. I don't know how many of you watch this. I forgot the movie's name. Harry Potter. Do you like Harry Potter movies? So the hero in the Harry Potter, he has DCD. I don't know how many of you know that. His name Daniel Radcliffe, I think.
Okay. So, is there any more questions? I think
I think I
you
see
have.
some more questions. Somebody asked home risk assessment for such kids and any modification recommending. So these children will not need modification of any household things as such, because they don't. So when I said hidden disability, they don't have a physical kind of disability, like as in you see with cerebral palsy kids. So they don't need modification of changing the house, but slight modification of things what they do. So when I say modification, so instead of holding a pencil with just the normal hand, they can have a pencil grip. So that's a small modification in that. So that kind of things. Somebody asked about elaborate about modification. See, if you need to elaborate, you need to elaborate on every task. If you ask for a specific task, I can say how to modify the task. Say if they find it difficult to brush with a big brush because they're so hard to manipulate that, you can use a small brush. That's one modification of the accommodation or modification of the task. And sometimes if they find it, a lot of people put on the shoelaces by standing and just bending down. And if that is the difficult, you can ask them to sit in a stool and tie the shoe. And that is a modification of the task. So these are some examples. I hope you answered. I think somebody asked that question. Can DCD found with other comorbidity? Yes. Kids with ASD, ADHD, dyslexia, dyscalculia, they all can have DCD as comorbidity. Not all the time, but like a lot of cases, yes, definitely.
Okay, I think we have covered all the questions, sir. So, thank you so much for your patience in answering all the questions, sir. Would anyone like to share your feedback regarding the session?
Hi, Bharat. It's Mohan here.
Hi, Mohan.
It's a wonderful presentation, and it's been a great pleasure listening to you. Definitely for people who are listened in India, they've been a good eye-opening, and you have presented so much of details like which so many professionals and like budding therapists will be like learned of so far. And it's been amazing, and all the information you have provided us up to the mark, and like more all the videos, and really like it's more opportunity for all the people and the therapists in India to understand better about DCD and dyspraxia. It's been great. And I have one small question, like as I said, like the sensory processing and the dyspraxia and DCD has like a correlation or impact. I think it's been a huge thing for children in India have been identified with more sensory processing than into dyspraxia. So would you elaborate into that, please?
Like I'm not a great expert in sensory integration. I do sensory integration, but like in India, possibly lots of children with DCD could be diagnosed with just sensory processing disorder. Like, because children with DCD, they're missing a vital link. The main difficulty with kids with DCD will be body awareness, which has a strong relation to sensory as well. That's the common thing, I think, which connects the both. Whereas kids with sensory, what I will say is kids with DCD will have a lot of sensory processing difficulties. But I think in India, if people are looking for sensory, they also need to look for the signs of DCD as well when they're looking at it. That would be my advice. I don't know if I answered my question, your question, Mohan. Sorry, I don't know if I answered your question.
Yeah. Thank you very much. It was more informative. Thank you very much, Bharat.
Okay. Would anyone else would like to share?
Hi, sir. This is Yashwant, final year OT from RAMACHANDRA, sir.
Hi, Yashwant.
My sincere respects to everyone in this Google meeting. Thank you, sir, for your patience answering for everyone's question. And yes, it is a very unique topic. And yes, sir, we have gained a lot of professional knowledge about this developmental coordination disorder. And yes, we can, if we receive a patient with DCD, I'm sure we can intervene with the standardized scales and few strategies you told. And thank you so much for the tabular presentation, sir, where you have shown with the age-wise what are the difficulties they'll be facing in ADL, sales pair, and so on. So that will be helpful for us, for if we're going to set goals for them, short-term and long-term, it will be very useful. And thank you so much for that tabular presentation, sir. And finally, my faculties like Dr. Raghuram, sir, a HOD Department of OT, and he's a convener and president of TNAIOTA. And also, I would like to thank Dr. Sundar, sir, Occupational Therapy and Rehab, and tutor Rima ma'am for this wonderful session. And yes, sir, your presentation and your session and everything was, thank you for sharing your experience in DCD. And sure, we will use your technique and strategies if we gonna receive a patient with DCD. Thank you, sir.
Thanks, Yashwant, for your kind words. Thanks very much.
Thanks, Yashwant. Someone else would like to give your feedback?
Good afternoon, sir. I'm Kritika, studying Bachelor of Occupational Therapy, third year in Sri Ramachandra. Sir, I would like to thank you so much for loading us with a great presentation. You have presented us with tabular columns, and the video that you showed the difference between the normal and the DCD child was very nice, and it made us understand even more better. Thank you for this informative section, and thank you for your time, sir. Thank you.
Thanks, Kritika. Thanks very much.
Okay, thanks, Kritika. I would like to formally thank each and every one of you. So let me begin by thanking the administration of Sri Ramachandra Institute of Higher Education and Research and the Tamil Nadu branch of IOTA for giving us this opportunity. I extend our gratitude towards Dr. BHARATH for agreeing to speak to us, and also for sharing his experiences and knowledge with us, and his patience answering almost all the questions that was coming up in the chat box, and doing the presentation side by side, and also for your time. I know it'll be very busy schedule for all of you over there. Thank you for your time, sir. I would like to thank all the participants who are attending the webinar. I know there are a lot of students and professionals within India and from abroad who are participating. So I thank everyone on the behalf of Occupational Therapy Department, and a special mention to our assistant professor Sundareshan sir and our HOD sir for coordinating and organizing this webinar. This is the second webinar that we are conducting. So, and all the good feedback that we received in the comment section, and for the interaction, and for all the interaction, I thank each and every one of you. Last but not the least, I would like to thank the students of Sri Ramachandra for their support and cooperation. Thank you.
Thanks, everyone. I'll just like to say thank you, everyone, for the patient listening. I hope I had shared my knowledge a little bit to you all. Thanks very much again. Thanks everyone.
Thank you, sir. Thank you so much.
Thank you, Dr. Raghuram. Thank you very much.
Thank you, sir. Okay.